I've spoken on this before, but we've seen an increasing number of broken or cracked teeth over the past few years. There really seems to have been a big uptick in people clenching their teeth. People who grind their teeth tend to know they grind their teeth. There's a lot of side-to-side motion, even during the day, but especially at night. But that side-to-side motion, kind of sliding back and forth, it's gonna wear your jaw out significantly, but it's also gonna have pretty rapid impacts on your teeth, where the teeth start to flatten and wear down. If you think of cow teeth, they chew grass, they grind their teeth back and forth, so they have very flat teeth. Humans, we should have relatively pointy teeth. There should be lots of nice cusps and peaks to our teeth and lots of anatomy. And if you look at this patient's teeth, there's a lot of good anatomy there. There is some slight flattening in a few spots, especially across the front, but in general, not a heavy grinder. This is someone who's more of a clencher. There's a lot of downward pressure at night, and just that squeezing causes a lot of detrimental effects on the teeth. The first thing we start to see over time is recession, where the gums are dropping down. Now this you're not going to see because the way they've cut the model to make the guard, but patients come in and you've got more recession. That's driven in a large part by grinding. The downward pressure on the teeth causes the teeth to rock back and forth in the socket, and then over time that gum drops down and recedes. So if you see on a young person a lot of recession, it's typically someone who's clenching their teeth at night. The other thing that we start to see are little crack lines and fissure lines running across the biting surface of the teeth. That's a sign that there's so much force coming down at night that it's spreading the tooth apart. You really don't realize how much force you can put on your teeth at night. During the day, your brain's gonna stop you from biting down too hard. Most people start to clench, but then without even realizing it, their brain stops them and they move on. At night, you lose that inhibition and that force keeps tightening and tightening and tightening. And over time, it can split teeth. I've seen several patients lately who have cracked teeth so irreversibly that we have to pull the tooth out. There's no way to fix it when it's split all the way down to the root. And it's not that they bit down on anything. There's no momentous event in their life where like, oh yeah, I felt it crack. It's just they have been clenching their teeth so hard that it's driving a wedge into just the point of one tooth into the valley of the other tooth. Over time has split it.